studios in New York, here again is Ann Curry.
Back to our story now. More than 2/3 of American men will lose some or all of their hair over their lifetimes. So a year ago, we issued a hair-raising challenge to 5 balding men, asking them to test a variety of different techniques for growing hair. Now we're about to find out what worked and what didn't. Here again, Rob Stafford.
The results are in. Our fearless and formidable Follicle 5 volunteers spent 12 months trying different, even unusual treatments to try to grow hair. These men spent years worrying about their thinning hair, and when we first met them, they told us about some outrageous treatments they tried in the past. Richard is our single twin.
They told me to put a pantyhose on your head.
You put pantyhose on your
pantyhose on my and I knotted it right up. And I said, okay, I'm gonna keep a picture of that.
I'd like to see that.
So obviously, I was very desperate at this point.
Our volunteer Paul, who wants hair again like a rock star, once took some unsolicited advice from a stranger at a shopping mall.
He said, "You know what you need to do is you need to buy a horse hairbrush and brush your hair." And I'm like, "Excuse me, what do you mean? What are you talking about?" He goes, "For the bald spot."
So did you buy it?
Yes, I did. I will confess, I was there every night, 200 this way and 100 that way.
So what causes most hair loss? Genetics, experts say. Sensitivity to the hormone DHT is the culprit. This byproduct of testosterone interacts with hair follicles, causing them to shrink. The hair then thins and can fall out. Eventually, follicles can stop growing hair completely.
It's a problem that affects all races and women. The American Academy of Dermatology estimates that nearly 40% of men and women have visible signs of hair loss by age 40.
Good morning, I'm Dr. Romanelli.
Now, to judge whether or not our volunteers actually grew any hair, we had Dr. Paulo Romanelli examine each of our men at the start of this project.
Smile. Some substantial results.
6 months later.
Welcome back.
And then after 1 year. A professor with the University of Miami's dermatology department, Dr. Romanelli will later give his opinion on how well these purported hair-growing treatments actually worked. Meanwhile, our volunteers told us they use their products religiously. And now, 12 months later, it's time to see how everyone did.
By the way,
Joe is our teacher in his mid-50s who sometimes gets teased by his students over his thinning hair. He used 2 drugs at the same time, Propecia pills and minoxidil lotion. Occasionally, he found the lotion to be messy.
At times you don't want to have that greasy look, and at times I don't want to have it spill onto my pillow.
So there's quite a bit of rigmarole around all the applications.
Right.
And with Propecia, a small percentage of users have sexual side effects.
6 months ago, you didn't have any of those side effects, any problems?
No side effects at all. My friends tease me all the time because I use the word vero. Okay,
Here's how Joe looked at the beginning of our project. Here he is at 6 months and at 1 year. The cost of both drugs is about $900 a year. And Dr. Romanelli was surprised by Joe's results.
Joe did quite well in the first 6 months, and I like to say remarkably well in a year time. What I saw on Joe was the hair much fuller, thicker. Propecia usually doesn't work that well on people that are over 50.
Even though the doctor thought Joe had good hair growth and would be pleased, Joe came to a different conclusion after completing this year-long project.
Is it worth it?
I don't think so. I'm a no-frills kind of guy. You know, if I go bald, I'm go bald.
Hector is our computer technician. He'd often sit in the back of training classes so people wouldn't see his bald spot. He used the fish extract product from Finland called Viviscal. Here is Hector at the beginning of our project, at 6 months, and 1 year later. The cost for Viviscal is about $660 a year.
What kind of progress do you think you've made?
I don't think I've gained any hair, but I don't think I've lost any hair. I think I've just maintained what I had to begin with.
Dr. Romanelli agrees.
Hector, I didn't see any major growth this time. At the same time, I didn't see any major hair loss. I think he's quite stable.
But Hector also had a major change of opinion about his hair. He felt just being a part of this Dateline project gave him a whole new outlook on hair loss.
Are you still sitting in the back of the room when you go to work at those training classes, worried that people are going to see that bald spot?
No. This whole thing here has changed my perspective, and I'm a lot less conscious of, you know, the baldness. Just sitting here with these guys and talking about it, it was kind of like therapy.
George, our twin who is married, used the LaserComb. It's a device that emits a low-level laser that's supposed to stimulate new hair growth. This is George at the start of our project, at 6 months, and after 12 months of using the $700 comb.
I've noticed no hair loss in the sink anymore since I've been using it.
Do you think you've grown any new hair?
I think I have, but then again, I want to wait till the results tell me for sure.
Welcome back.
So you're gonna let me know what's going on, huh?
George, I definitely saw some new hair on the top of his head, right here, but not much on the two temporal areas.
George is thrilled to hear the doctor's opinion.
I was cautiously optimistic, you know, but really now I can say that that cautiousness can go away.
As for his single brother, Richard, he tried Propecia, which costs about $600 a year. This is Richard when we first met him. Here he is at 6 months, and after 12 months of using this FDA-approved drug.
Richard, you've been taking Propecia for a year. How do you think you've done?
Actually, I felt very confident at the beginning. The first 2 to 3 months, I saw like some little birth growth there, little spuds coming out, you know, like a little cactus. And then suddenly, then I didn't see it anymore.
But Dr. Romanelli feels Richard actually grew more hair over the last 6 months than he did in the first 6 months of using Propecia.
Richard did quite well. Richard, same as his brother, grew hair mainly on the top of his head.
As for Paul, who wanted to have hair as long as a rock star, this is how he looked before he had his hair transplant surgery. This is him after 6 months, and here he is after 1 year. Paul also used minoxidil and Propecia. Dr. Romanelli thinks overall he had the best results.
Paul had incredible results, definitely the best of the 5. He had a lot of hair growth and very good success.
But hair transplant surgery comes at a steep price. The cost for Paul's operation, $10,000.
$10,000 for the hair transplant. Is that worth it?
In my case, I would say yes. I mean, in self-esteem and the way that I feel, I actually feel like, you know, hey, I am younger, I am retaining it, I am still an active, vibrant person. Now that I have hair, I can honestly tell you, I go out a lot now without my hats. I don't have one in arm's reach all the time anymore.
You might be surprised, but Dr. Romanelli says that in our unscientific project, all 5 of our volunteers had positive results. Either they stopped losing hair or grew more hair. The doctor adds that's a much better result than would be expected from the general population.
Who's going to continue using their products? Joe?
I think I would probably say no. I just want to age gracefully. I teach high school, and I could care less of my students, okay, care if I have hair or not.
$700 a year to continue the Viviscal, you going to do it?
Probably, without having expectations of growing hair, yeah.
Richard, are you going to keep going with the Propecia?
No, I'm going to save my lucky pennies. When it gets to that point, I'm going to look at Paul and I'm going to say, you know, I'm going to get it to transplants.
You want more?
I want more.
And Richard's twin brother, George, says he's going to continue to use his LaserComb, but he's going to try something else too.
What would happen if I took that LaserComb and then combined it with Richard's Propecia that now he doesn't want? So I might kind of steal some of that from him and do my own trial.
Paul, are you going to do another transplant?
Yes.
You're hooked.
Got to fill in the stadium. Doors are closed. Need to get everybody seated now.
The headbanger?
Yeah. Does it move yet? I'll be very happy going to the headbangers ball and not swinging my hair around.
The manufacturers of these products generally agree that people in the early stages of hair loss can usually expect the best results. And the manufacturer of minoxidil says its product grows hair on the top of a user's head, not the front. No matter, after 12 months, our Follicle 5 have either all gained new hair or maybe gained some new wisdom.
Hector, the moral of the story is what?
Bald is beautiful.
Earlier this month, our volunteer, Paul Silva, went ahead and had another hair transplant. He's thrilled with gaining more hair, but this time he had to pay the tab. To learn more about hair loss treatments, log on to our website. The address is dateline.msnbc.com.